Now, years ago, and probably even still today, they take history, doctors, when you go to them for the first time, of your parents' history, whether they had heart disease or not. Now, if a person's father and mother had heart disease, is there a good chance of the patient, the son or daughter, having heart disease?
Good question. One I dealt with for 4 decades as a clinical cardiologist. What I would do with that information, Sal, is when I hear of sudden death in the family under the age of 50, heart attack, or heart disease in 2 parents, I would turn your blood inside out. Again, in reverse heart disease now, I call it toxic blood syndrome. And I talk about that on my Heart MD Institute website many times. So I would check you for serum ferritin. I would check you for fibrinogen, C-reactive protein, homocysteine, Lp(a), hemoglobin A1C. Cholesterol, I haven't mentioned it yet, but that's way down on the list. In other words, I would check you for metabolic syndrome and making sure that you do not have genetic penetrance to Lp(a) or even homocysteine. High homocysteine levels will cause accelerated aging. So in those families that had early heart disease, I would check the genetics and check the blood markers of inflammation. Now, lots of times the family smoked. People who smoke together, they can croak together. I mean, that happens. People who pray together stay together. So in families that smoked, if their parents smoked and the children smoked and they got heart disease, I did not see that as a red flag. So environmentally, let's look at it this way. If your dad had a heart attack and died at age 47, but your dad was a smoker, ate a lot of sugar, was a type A, flaming person, working incessantly, had issues with emotions, held in emotions, and you did not follow your dad's, pattern.
Lifestyle, yeah. Mm-hmm.
You became a non-smoker. You didn't eat a lot of sugar. You meditated. You had a more balanced life. Would you get heart disease?
No.
I don't think so.
No.
This is where I feel genetics is playing a lower level than environment. So for you people that have been dealt a bad set of genetics, all that is basically just a little warning. After you get your blood checked for the things I mentioned, remember, if you're just like your dad or your mom and they had heart disease and you have the same habits, you could be on a treacherous course. But if you do the opposite of your mom or dad with heart disease, you're on a good course.
Well, what I've found, which is unbelievable, is when you look at parents and you look at the children, you look at obese parents, and you see most of the children are obese also. So the lifestyle, the eating habits, I think follow, in not all cases, but a good amount of cases, follow the children.
Right.
Well,
there's an old saying, and I probably spent about $200,000 in psychotherapy learning this, but children will follow what you do, not what you say.
Mm-hmm.
Children track energy, not words. So if an adult says don't smoke, but the adult smokes, they're going to smoke.
Right.
Now, the other side, and maybe I can take this to a higher level with your audience, I hope your audience is open to this. Whatever you detest in your child, emotionally, is what you don't like in yourself. Mm-hmm. And that took me a long time in psychotherapy to realize that. So your child could be a messenger. And a great book on that was Alice Miller's Prisoners of Childhood, where whatever you don't like energetically in your child is your issue. That's why people fly off the handle and sometimes yell at a child, because they see their own issue and they don't know how to deal with it. Right. So, hopefully we can take your listeners to that level. Right.